Good morning, everyone. Thank you for joining us today. I have the pleasure to talk about Beyond the Heart. Her mind matters. My name is Carolina Carvalho, and I'm a cardiologist, passionate about cardiovascular prevention, working in this field for more than 10 years. Today, I will have the pleasure to share this presentation with Dr. Rajni Nijhawan, who has strongly advocated for women's health for the last decades. We are both physicians working at the UHN Toronto Rehabilitation Cardiovascular Prevention and Rehabilitation Program. By the end of this session, we hope that you will be able to be mindful of the association between mental health and cardiovascular disease. Observe the signs and symptoms of mood-related issues, and be able to recognize resources available to support those experiencing mental health difficulties. Before we start, it's important to remind about important ground rules. These sessions are for education only. Connect with your healthcare provider for specific advice about your situation. We will answer questions generally, not personally. And we may not get to all questions today, but we will do our best to answer them soon and post online. I will invite Dr. Nijhawan to take the lead.
Hello, good morning, everybody. Thank you for joining us to today's Women Online series, which is the part of our Cardiac College online virtual program. We have recently adapted to this during the COVID-19 challenge. These talks are all inclusive, so everybody is welcome to join it. We do discuss some women-related specific details on this. But basically, anybody can join us. I'm going to start with introducing a little bit of facts about the heart disease, and then go beyond to the mind and emotional health. As you know, heart disease is very prevalent in Canada. It is the second leading cause of death among Canadians after the cancer. And right now, if you look at globally, it is also considered as #1 disease in the world. Unfortunately, this disease was considered to be just a disease of men at some point, but women have started experiencing heart-related difficulties, conditions more so. And in women, currently, it is #1 reason of premature death. So I will like to tell you that our health-related wellness, we are not just focused on the physical health, but also the health of, next slide, please, health of wellness and the mental health, because in total, the wellness of every human is not just physical, but also emotional and mental. Slide number 2 shows us that cardiovascular health in women, heart disease is 5 times more likely, women are 5 times more likely to die from heart disease than the breast cancer. And if we look at the health of women on mortality, next slide, please. The cardiovascular mortality trends in the early 80s was more among men, and then they start declining towards the 90s and year 2000. So I'm looking at this slide that you can see. On the x-axis, there are years, and on the y-axis, which is vertical, there are deaths per thousand. And you can see the graph is showing the male deaths with a blue line and female deaths with the red line. So women started dying more starting 1990 and to year 2000. And when we were going through this time period, the Time magazine in 2003 had discovered saying, talking about the women and heart disease, 1 in 3 women die with heart disease. That time, a red dress campaign or the Go Red campaign started in America, which came to Canada as the Heart Truth campaign. And after that campaign, we started seeing that we created more awareness among women and men, and the death rate started declining. And you see that after that line, the death rate has gone down in both men and women, but unfortunately, since 2010, the curve for the men has gone up, although for women, it has flattened down a little bit. No matter what, still, we see that a lot of men and women are still dying in Canada. This graph is showing the population of United States of America, but Canadians are not any different in the mortality trends. Next slide, please. The good news is that although we have seen so much of heart disease and death occurring in Canada and US and globally, 80% to 90% of this heart disease is all preventable, and this is all about the lifestyle and the lifestyle modification. So that's where the role of our cardiac rehab prevention and rehabilitation comes. And some of you may be already participants of our program. Some of you may be participants of other programs. And some of you may have finished our program and still come to join our cardiac college online and our programs as graduates. So thank you for doing that. Next slide, please. We see that traditionally, when we look at the risk factors in population, we have been focusing on our habits and our lifestyles and our medical history. So how we live, how our blood pressure is, how our sugars are, what our cholesterol is, whether we are having a habits of drinking a lot or smoking, or whether we have sedentary lifestyle. So all those behaviors and medical history put together are considered as our risk factors. And we know that from Dr. Paul O's previous teaching online session talk that he presented 2 weeks ago on May 5th, I believe it was, he talked about the risk factors. So some risk factors are modifiable and some risk factors are not modifiable. So some of the things that are now existing in the literature are about mental health being our emotional wellness. So in the emotional wellness, we are now talking about how we have co-relationship between depression and heart disease. So we know that more and more people are living with heart disease and depression. And the new evidence is showing that heart and brain health goes hand in hand, and the mood and our mind works also all together in the wellness of human being. Recently, there has been some research which talks about how people who are living with depression are having also more and more living with the heart disease. So that information is slowly coming into the literature, and they're talking about how it is a two-way relationship. So people who are living with heart disease are found to be also living with depression. So this has been very obviously noted in people who, not people, but young children, and young children, adult youth, I mean. So some youth who are living with depression or are living with manic depressive disorders, they were found to be having a lot more heart disease, increased risk of developing the heart disease. So American Heart Association came up with a statement in 2015 with a warning that teens living with depression and bipolar disorder stand at increased risk of developing cardiovascular disease earlier in life, and hence we should be monitoring and intervening and preventing it. For years, we have known that there is a direct relationship, and as I said, heart disease and depression is a two-way relationship. At least 25% of heart patients live with depression, and definitely there is no explanation yet, but the relationship is emerging. More and more research in the last 5 years is being done, and there is impressive body of evidence showing that compared with people living with depression or depressive disorders or even having some symptoms, they have 64% greater risk of developing heart disease. And also, people who are depressed and living with heart disease are 59% more likely to have future adverse cardiovascular events, which is heart attacks or cardiac death. So looking at all this, now some people in the literature or some researchers are saying that is the depression cause of heart disease, or is it a risk factor on its own? So at least in some studies, it is pointing out that it may be a risk factor in women. So stay tuned. There will be more evidence and we will keep you updated. So people have started looking at sex differences in the non-traditional risk factors among patients after a heart attack. So we know about the traditional risk factors that I just mentioned earlier. So this is considered as a non-traditional risk factor. So on this slide, you can see they have shown young men and young women. Young women are in the pink and young men are on the blue. And you can see the slide, and the x-axis or the horizontal axis, there is depression, anxiety, and stress at home. And on the vertical axis, you can look at the percentage. So this is a study in which was published in the cardiology, Canadian Journal of Cardiology in 2014. So you can see that depression in young women is higher than depression in young men. Anxiety in young women is higher than young men, and so is the stress at home. So you see the all three bars, pink bars are higher than the blue bars. So we are looking at how depression is affecting young women. Next slide, please. So now I'm gonna ask Dr. Carvalho to take over. She is going to go over with the stress, anxiety, and depression and what that does to us.
Thank you, Dr. Nijhawan. So here we have our first take-home message, summarizing what we have talked so far. So stress, anxiety, and depression are more prevalent in women, associated with cardiovascular disease. But the good news is we know that we can treat these conditions. As Dr. Nijhawan said, there are a lot of studies assessing the correlation between mood disorders and cardiovascular diseases. And one of the greatest and the largest study was the InterHeart, that was a Canadian study, but that included more than 15,000 patients in 52 countries. And this study is assessed not only stress in general, but it went into the details, and it assessed the stress at work, at home, financial stress, stressful life events like a wedding, divorce, new job, loss of a job, and death. And I would add to it the pandemic that we are living. Also low locus of control and depression. So these are examples of stress or mood issues. And this study showed that those who were exposed to a combination of these factors had 2.7 more likely risk of having a heart attack. So it looks like psychosocial risk factors are, yes, indeed, associated with cardiovascular disease. More evidence has come recently associating the burden that caregivers face. So this study that you are looking at here evaluated women taking care of ill spouses, and it showed that those that were taking care for more than 9 hours per week had an increased risk of heart disease compared to those who were not having this task of taking care of someone that was ill. Okay, so it's something that raises our attention, and we still need more studies, but there are different tasks that women do and that we need to take more attention. So now moving on, we have feelings that we may face after a cardiovascular event. It's not only for women, but also for men. So after a cardiovascular event or receiving a diagnosis of a cardiovascular disease, people react in different ways. And I would like to reinforce here that it's normal to have feelings like shock at the beginning, sometimes denial, sometimes guilty, and it may progress to anger, grief, increase the stress and anxiety. And at the end, or not, or even sometimes at the beginning, we may feel that we are losing our enjoyment, our pleasure in things that before we were happy to do. And also we may face some low mood, and others may face feelings that are really suggesting the depression, okay? So how we will react to this diagnosis will impact the way that our cardiovascular disease will behave in the future. And I wanted to reinforce here that all these feelings may impact our sleep. And if we are not sleeping well, if we are not having a good night where we can rest our body, it will also impact our mood, and it may become a cycle, and it's when we need to ask for help. So the question is, okay, but you said that all these feelings, all these emotions are normal or are expected after a heart disease or a heart cardiovascular event. When it's time to think that it's no longer normal and that I need to look for help. Okay, so we all feel sad, worried, scared, or suspicious at times. And mental health problems can affect our feelings, our thoughts, our physical well-being, and our actions. But these kinds of feelings may become a problem if they get in the way of our daily lives over a long period. And this long period is something that is not really objective, but I would say at least 2 weeks, where you really can feel that your mood issues are interfering in your daily lives. So that's when it's time to look for support and ask for help. Okay, and now I will turn to Dr. Nijhawan, and she will talk about how we can improve our heart and mind.
So, thank you, Dr. Carvalho. So you have now gone over learning what does a mental health issue look like and how people after any cardiovascular event can live with these emotional and feelings of different level to all the way to developing depression, being in denial. But how can we do, or what can we do to improve on our heart and emotional health? To start with, it is important that we recognize that what we are experiencing and accept it. Once we have accepted it, then it is easier to deal with it. As some of you who have been in our program know that how we run the program is by focusing on identifying the risk factors and then trying to deal with the risk factors by making individualized plan and goal setting, and then making an action plan to how to come over with it. This is a nice quote that Dr. Carvalho has put: between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So between that space, this powerful space to response, and our response is what is our action plan. We at Rehab, next slide please, have been teaching, and people who do not come to our program or are new to our program, the way it works is we identify the risk factors, and out of the risk factors, there are modifiable or risks that we can change, and there are non-modifiable risk factors which we can change. So we go over those, as I've already mentioned about them a little bit before in my talk. So these risk factors, once we identify during the rehabilitation, we come up with behavior change and modify the lifestyle. and we individualize, look at the goals of every participant, keeping in mind what their risk factors are, and then the action starts. And in the action, what we do is we teach the healthy way of lifestyle. Number one is the physical activity. Move more, sit less is our basic aim. And according to the Heart and Stroke Foundation, the walking goal is 150 minutes per week or 30 minutes per day. And resistance training, frequent stretching and balance exercises for good bone health. And then healthy, balanced eating habits, watching for your habits of alcohol intake and smoking. All this actually is available on our Cardiac College booklet called Eat Healthy. What we can do is also take our prescribed medications. But for our mental health or for our emotional health, things that we can do are to stay connected, have meaningful connections, have a supportive network of friends and families, neighbors or colleagues, find creative ways of connecting, and learn to relax. And for the relaxation skills, one can do the stress reduction techniques, meditation, or deep breathing. Some people enjoy doing yoga, which is a combination of your physical activity, aerobic, plus your mental health skill tool. Do something that makes you feel good. Try and learn new hobbies. During this pandemic, people have been feeling extremely stressed and have turned to doing some listening to more music, dancing, learning to do some gardening or baking. As you may have heard that there has been, it has been difficult to find some flour or yeast because people have started baking so much. Now that the weather is getting better, one can also start gardening. Some men are doing woodworking. Women have started to knit and learn. So all these make you relaxed and makes you feel good. As Dr. Carvalho has mentioned, sleeping well is very important. So it is very important to have routine while we are working from home. Not having a routine can create a very irregular sleeping schedule. So it's very important that we sleep well and we rest well to recover. We must focus on our emotional and mental health. Hiding our feelings does not help us at all. It is okay to be vulnerable. It is okay to show your emotions. It is okay to talk about it. Learning to talk about it is also a good skill. Since we are all isolated, it is also very important to find different ways of connecting with people. Being safe at home. We have been told to stay at home, but safety at home has also become an issue for some people. Living safe at home in a good environment for children and for everybody is very important. And it is very important that we stay sportive and live in a sportive family and accept each other, but also have the resources available in case you are dealing with violence. So cardiac rehab, as I mentioned, these are the things that we learn at cardiac rehab, because we know that there are significant reasons of, there are significant benefits from this cardiac rehabilitation. It reduces cardiac events, it decreases readmissions or hospitalization, it decreases our mortality and increases our functional status and our well-being and our quality of life. And certainly it also improves on our mood. So I'm going to hand it over to Dr. Carvalho. The next couple slides are about the tips of how to do our how to make these changes. This is nothing that you need to learn from me. So we're going to leave them on the site for you to read them. And we're going to go to the resources, and Dr. Carvalho is quickly tell us which are our resources that we can go over.
Okay, thank you, Dr. Nijhawan. So if you have not done so, I strongly recommend you to access and explore our website, the Cardiac College. And if you access the Feel Well, you can see a lot of resources that will help you to boost your mental health. There is also a very important tool available there called Thrive. It's a 12-week challenge, and you can set up a plan with goals that will be chosen by you. And in the bottom part, in purple, you can see that we have some weeks or some sections dedicated to manage stress, depression, burnout, teaching you how to sleep well, and also how to strengthen your social relationships. Another very important resource is the Learn Online every Monday to Thursday at 1 p.m. And especially on Mondays, we have sections that we have Dr. Ritav, that is a psychologist that works here at the Ramsey Cardiac Rehab. And he runs a lot of sessions providing a lot of counseling, tools, resources that can help you to cope with a cardiovascular diagnosis, or even to help someone to face these new challenges. And here at the Toronto Rehab, we also have Claire, our social worker. And if you are a patient attending cardiac rehab here, and you are interested in talking to one of them, I recommend you to connect to your exercise supervisor and express your interest in talking to one of them. So now I will ask you to pick up your phone, and if you want, take a picture of these resources, but don't you worry, because they will be available online. And I want to call your attention that if you are experiencing cardiovascular symptoms such as chest pain or any other symptoms that would bring you to the hospital, you should not delay or avoid going to the hospital due to COVID, okay? Hospitals are a safe place to be. They are very well prepared. They have all the protective equipment to prevent you or them to get COVID. So if you have chest pain or any other cardiovascular symptoms, you should go to the emergency departments. Don't be afraid of getting COVID, because staying at home could be worse, and going to the ER can actually save your life, okay? So it has been said, I have already mentioned about the Cardiac College. We also have the Diabetes College. I would call your attention to the Heart and Stroke Foundation. It's a wonderful website, and we have other resources here that you can access for cardiovascular information. Now, if you want more information regarding mental health or mood issues, I recommend you to go to call one of these numbers if you need, of course. And I would recommend you to also pay attention to this assaulted women's helpline. You may not need it, but we know that because of COVID and people staying home more prolonged times, a lot of women or others are suffering some kind of assault, and it's important to raise our attention and to provide help and support to all those women. I also would like to comment on the CAMAGE website, a very good resource. And finally, we have the Wellness Together Canada. It's an amazing portal where you can find a lot of resources and links to other websites. And as well, I would like to comment on the Bell Let's Talk. It's a place where you can also find resources and you can chat and have your concerns addressed. Finally, the last one that I will mention is the Big White Wall. It's a very interesting resource. You can anonymously log into this website and have some counseling. It's free. And the good thing is you don't need to identify yourself, okay? So these are the resources that I have to you. And the last thing is the apps, because we now are in this generation where there is an app for everything. So there are a lot of apps, very good ones, but I included here my 5 favorite. And if you have any other app that you think it's a good one, I invite you to post on the Q&A, and then we can learn from you. Okay, these apps are free and they provide you with meditations, mindfulness. There are different, just music sometimes. There are different ways of doing different things, programs for stress management. So I really recommend you to access one of these resources. So in summary, we talked today that cardiovascular disease and mental health are associated. Boosting your mental health can improve your heart health. We know that signs and symptoms of mood issues can be subtle. So give yourself time to reflect on your feelings and take charge of your health. This is a very important message from this presentation. Lastly, but not least, many resources are available to support those experiencing mental health difficulties. As you can see, in person, by telephone, online, or even with an app. So thank you so much for your patience. And if you have any questions, be prepared to post those questions on a Q&A icon. So if you have any questions, this is the time to post them online.
So while people are still typing their questions, Carolina, I have had a patient ask me in the past, and maybe I will share this with the other people, how the hormonal status in women play the role in cardiac disease. So I just wanted to give this information that when we are young, the hormonal imbalance can present in the form of something, say, like polycystic ovarian syndrome, which some young women can have. And that puts them at a higher risk of having heart attack. There are other conditions which can affect young women on their arteries and vessels, and that can also increase their risk of heart disease. Taking birth control pill in young women can also increase their risk of heart disease. During the fertility years, some women can have high blood pressure during their pregnancy. They can have diabetes during their pregnancy, or if they're smoking, that adds to the risk of having heart disease. And sometimes these women can have preterm baby, or they can have complication of pregnancy with having preeclampsia, or a condition where it's a complication during pregnancy when you start having swelling on your feet and spilling protein in your urine, and your blood pressure is increased. So these all conditions can ultimately lead to the risk of having heart disease. So these are sort of the additional risk factors in women. And when women start having change in their hormonal status, which is towards the menopause, the decrease or the loss of estrogen protection also increases the risk for women to have heart disease. So I hope this question asked by one of my patients in the past will be helpful for the people online while they're thinking about their own questions. I will let you take the next question.
I'm just gonna interject here. There are a few Q&As that you can get to. There is one in the chat that I will just read out quickly, which is, what kind of resistance exercises do you recommend when you are at home?
Do you want to take that, Carolina?
Sure. So this is a very great question. I recommend you to tune on the Thursday afternoon sessions every Thursday at 1 p.m. And we have Rob, Renee, and other exercise leaders here teaching resistance exercise for all level of fitness. And if you by any chance if you are not able to access the session, no problems. The sessions are recorded and available on the Cardiac College website. Okay.
I can also add here, we did a wonderful session, the beginning or the opening session on the Women Online on the 5th of May, where we did the resistance training. And that session actually included specifically for women and at different level of physical capability. So if you are less than a normal level of resistance training, those exercises will certainly help you to learn. We also have videos on Cardiac College if you wanted to review those. And as Dr. Carolina mentioned, we also have live sessions. We did a couple sessions on resistance training already, but we will be continuing to do these if you wanted to join them live.
Dr. Nijhawan, I would like also to emphasize that the women class, for the women class, we will have the first Tuesday of the month at 10 a.m. we will have a session dedicated to exercise, okay? And of course, it will include resistance exercise. So Tuesday, first Tuesday of the month at 10 a.m., okay? And we have a lot of questions here on the Q&A. I will start I would like to remind people that the questions are anonymous, okay? And there is someone talking about Dr. Rita's stress management course. Yes, it's a very good resource. I didn't have time to comment. So there is a course of stress management, where Dr. Rita teaches different techniques for people to cope with stress. And if you are interested in these sessions, I strongly recommend you to talk to your exercise leader, voice this willingness, and this person will refer to him. And in the future, because it's 5 weeks of appointments, then the next time that he has a group starting, you can join the group, okay? There is also someone asking here if there is any kind of investigation of heart functioning after a stent without doing an angiogram. So there are different ways to access heart functioning, and I invite you to access our class, our presentation about how your heart works. It's available, which was at the beginning of March, if I'm not wrong. And there is a dedicated page on Cardiac College explaining how the heart works, which exams can be done to access the heart. And I believe that this is an amazing resource. And if your question is not answered, I will be available to answer the question in the future. You just reach out to your exercise leader. So there is someone asking about anxiety after a heart incident. So we know that anxiety is or can be associated with increased risk of a heart incident or a heart disease. It's true. But this person is asking how you can control anxiety so it doesn't impact the heart. Yes, so this is a very good question. And so I would start mentioning that a little bit of anxiety, it's in fact helpful, because for example, if you need to do an important task at work, you have to have some kind of anxiety or some kind of alertness so you are able to do that task, okay? The problem is when this anxiety is changing your daily life, you are not being able to concentrate, you're not being able to sleep, things like this. So the answer, how we can manage or can we decrease anxiety? So there are a lot of different ways we can do. I would recommend you start doing exercise. We know that exercise is a good way to decrease anxiety. Other ways are having mindfulness exercises if you want, meditation if you want, paying attention to things that bring you joyness, for example. Try to find in your daily life what you like to do, and try to concentrate your time in those actions. For example, some people like to do gardening, so put some time on gardening. Others prefer to read a book. What I'm trying to say, do something for yourself. It's very important. And try to reach one of those resources that you have just shared, because there are plans there that you can follow to manage your stress. So there are, for example, in those apps that I shared, there are weekly activities that you can join to decrease your stress. Same thing for Thrive, our 12-week program. There are weekly exercises that you have things to do to decrease your exercise, okay? So let's see. Lisa, do you think we have time for more questions?
You could maybe do one more question and then we'll wrap up. Any additional questions we'll post online with answers there if there's another question you see. I'm not sure if there are any more.
Okay, yeah, we have more questions, but I think that because of the time, we can answer just one more and then we will answer the others offline for sure. So let me see here. There is someone asking, what's a quick fix for additional stress with family and current pandemic? Any special activities? Yes, this is a very good question. So we have, if you access the Monday sessions at 1 p.m., Dr. Rita and Claire have shared a list of activities that you can do at home with your family or by yourself while you are isolating yourself. So it's a very interesting list. There is something, a lot of things that you may be postponing before because you didn't have time to do. And I would say that now it's time for, so for example, a lot of people are starting baking, starting making cakes or starting painting. So I would recommend you to start doing something that you may be willing to do before and you didn't have time. And if possible, do this activity with your family relatives. If you don't have anyone at your home, it's not a problem. You can reach out doing, if you have a device, you can call someone else. You can try to make online calls as we are doing right now. So there are different ways to do it, okay? And I think that now we have reached our final question, and then the other questions we will post the answers online. So I would like to invite you for next Tuesday, May 26th at 10 a.m. to learn more about the history of breast cancer with Dr. Harvey Schipper. I would like to reinforce that this session is open to everyone, not only for those with breast cancer. And if you have a family relative, or even if you are a man and you want to attend this session, this is really open to everybody, okay? So thank you so much for joining us today, and stay safe and keep health.
Thank you, everybody.